This study, I think it's crazy. Plant-based diet versus standard diabetic diet. Like diabetic, not even like standard Western diet. This is already adjusted to people suffering from diabetes. 74 weeks, and the plant-based diet has been shown to be 3 times more effective at controlling blood sugar. Insulin sensitivity improved in just 3 weeks. Jesus, like 3 weeks, everyone can be that patient and then see the results and be like, oh my God, why didn't I know earlier? So 43% reduced or eliminated medications.
Καλημέρα σας, καλώς ήρθατε. Ευχαριστούμε πάρα πολύ που είστε μαζί μας και σήμερα. Hello, welcome. Thank you so much for being with us today. The speech we're going to listen to is by Dr. Sophie Engelhardt. She's a vegan medical doctor specializing in pathology, where she went from diagnosing chronic illness and cancer to educating and supporting patients on their journey to better health, helping them to understand and successfully prevent common diseases. All of that with a whole food plant-based diet. She's also working as an actress and animal rights advocate. Today, she will share how going on a plant-based diet can help prevent the most common killer diseases and support long-term health with her experience as a pathologist and plant-based health advocate. We're ready to listen to your speech.
Thank you so much for introducing me, and thank you so much for coming. It's my first time in Greece, and I have not learned more than Kalimera and Efharisto. So I think these ones are really good. I've been training as a pathologist for over 2 years now, and on a daily basis, I'm giving diagnoses like colon cancer, endometrial cancer, ovary cancer, and in the other work I do as a pathologist as is autopsies, I see the manifestation of so many chronic illnesses we're struggling with today all over the world. And for me, it came to a point where I was like, is this really what life should look like? Is this really what we're facing? Is arteriosclerosis, diabetes, getting a heart attack or a stroke inevitable? Or are there things we can actually do to prevent that? So as a doctor, I love science, and there's luckily so much science that pinpoints everything into one direction, and that is going on a whole food plant-based diet, even though you might never have heard this one from your medical doctor yet. 2 days ago, I just want to make a short intro into this, has been a worldwide congress where the word plant-based has been mentioned 55 times, and there's an estimate that about 15 million lives per year could be saved by people going on a plant-based whole food diet. That is pretty decent, right? So I'm going to talk about what we can do, what the main killers are in the first place, to know what we're facing, and how to hopefully avoid becoming that sick. So let's dive into it. So the #1 killer worldwide is not the end disease, like getting a heart attack or getting a stroke or dying of kidney failure after having struggled with diabetes for years. It is actually diet. It kills more people than smoking because we've been having really great education about stopping to smoke. We see decreasing numbers in lung cancer, which the main reason for is smoking or quitting to smoke. The #1 killer is not movement, or lack of movement, inactivity, and neither is alcohol. It is what we eat. And good thing is, nobody forces us to put anything in our mouth but ourselves, so we can choose 3 times, or 4 if you're in it for a snack, per day what we're eating. So let's focus on putting good things in our mouth. So 11 million deaths. This is an old number because, as I just told you, the newer numbers, it's 15 million deaths per year are caused by a poor diet. And that is actually so many. Like, I live in Denmark now. Our country has only 5 million inhabitants, so this is 3 times Denmark just dead. If we would eat more veggies and greens, yeah, there would be not necessarily more Danes, but for sure more healthy and long living people in this world. So This is the oversight for this. Oh, now I turned it off. I just wanted to point the laser. No, I didn't. Well, let's start again. Where is it? Boop. That happens. So let's try again. I wanted to point on what are the highest or the leading causes of death in the high-income countries. So we have heart disease, as in based on atherosclerosis, getting a heart attack, also linked to the cardiovascular disease like atherosclerosis, we have strokes. On the second spot, kidney disease, mostly coming with diabetes and being a consequence of having elevated blood sugar levels for a too long amount of time. Colon cancer, this was actually the one that really got me because my first rotation in pathology was gastropathology. And the thing we're doing as pathologists, we get the specimens from our surgeons, which would mean half of the colon where the cancer is located in, plus adjacent lymph nodes. And what we're doing is we're taking pictures, measuring it, and we're cutting it into slices like bread, only to estimate or measure how deeply the tumor cells penetrate the colon wall to determine a tumor category, to then give a diagnosis and also tell the people in which stage of cancer they are to give the correct treatment in terms of chemotherapy. Some cancers need radiotherapy, very intense treatments. I was thinking, is there a chance that we might not even end up at this endpoint? And then I did some research, I read studies, and actually there is. The best thing you can do to prevent so many diseases, such as all of them I mentioned here, colon cancer is so diet sensitive. And I was like, I need to talk to people about what they can do to prevent this instead of certifying that they have gotten it through the years of 1,000 uninformed choices by eating animal heavy and saturated fats heavy, low in fiber diet. So when we're going on with the leading causes of death, we also have diabetes, which I mentioned, and also Alzheimer's disease. Sometimes I feel patients feel very helpless because there's not many solutions presented, medicine that has been tested and is not working as expected, but I really want to turn it around and see what can we do before we even go there. And it's surprising how many illnesses are actually linked to a poor diet. Lung cancers, I didn't write diet related here, but it can be. So also lung cancer can be diet related. With COPD, it's another lung disease where you, normally it comes from smoking, heavy smoking for a period of time. And also going on a plant-based diet has been shown that the symptoms of COPD can be how do you say? I'm thinking in 3 languages right now, can get better by going on a plant-based whole food diet. Respiratory infections, I would also say, like I was very shy with writing diet related to all of the 10 leading causes of death because as you're on a whole food plant-based diet, your antioxidant level in your bloodstream is higher than in a normal Western diet. So I would even argue that you have better outcomes when you have a respiratory infection while you're on a plant-based whole food diet. But I don't want to promise too much, so let's keep it scientific. And the last one is breast cancer. This was also when I did my breast pathology rotation, very, very close to my heart because a lot of young women and also elderly women get diagnosed with breast cancer. And I've read studies that 9 out of 10 women have never been talking to her general practitioner or gynecologist about how to prevent this or when you were met with this illness, how to continue living a healthy lifestyle. So 9 out of 10 women don't know what to do, but it's actually very simple. It's not easy, but it's simple. It's a plant-based whole food diet, both for estrogen-sensitive and insensitive cancers, crossing out the alcohol from your diet, a healthy body weight, and movement. And I think it's shocking that we're talking so much about the incidents are like on the rise, more and more people get sick, but we're not talking about how to actually do something against it with our own power. So that's why I'm here, to talk with you about that, so we can hopefully live a very long life, happy long life, adding years to our life and life to the years. So, heart disease, that was the top one in the leading death cause statistics. I'm sorry to say, but all risk factors are diet-related. Cholesterol is only found in animal products as cheese, meat, and plants don't contain cholesterol. Our bodies are producing cholesterols on their own. This is what we need, it is essential, but adding it through your diet is unnecessary. High blood pressure also comes from a diet rich in salt. A lot of produced animal products are high in salt, saturated fats, also leading to diabetes and obesity. And the core element of the heart disease is the inflammation in our bodies, leading to the clogging arteries and closing off the arteries in our heart, and also the second leading cause of death to our brain, as in strokes. So, surprise, plants reverse heart disease. That is actually fabulous, and I have never heard anyone talk about this, but let's dive into the science. There has been studies conducted where people have been put on a plant-based diet and lifestyle changes, so as crossing out the alcohol and adding in gentle movement, which would be 20 minutes per day of walking, which is doable, I think. Yes. And by doing that, the patients had a 91% reduction in chest pain. And I don't know if you've ever experienced chest pain. I haven't, but as I've heard from my patient, it's very uncomfortable and also very scary. So 91% reduction in chest pain is fantastic. And that's by changing your diet. And they also looked at the actual cause of this pain, because the pain you get when you have coronary heart disease is because your muscle cells in your heart, they don't get enough oxygen, they don't get enough blood, and it's actually the pain of your dying or about to be dying cells. So that is very scary. And we could also see that arterial blockages just decreased. Fantastic. Next study that has been conducted on 198 heart disease patients, they went on a plant-based diet for 12 plus years, which is amazing, and 99.4% of the participants had no cardiac events. Yeah, I'm just going to leave it like that to sink in. And what's happening? Lower blood pressure, reducing cholesterol in your diet, clearing the plaques that are the reason for the obstruction, and reducing the inflammation in your body. Fun fact, by just adding grounded linseeds to your diet, you can lower your blood pressure as if you were taking medicine. So that's very nice. I would recommend that eating a tablespoon of ground linseeds every day. It's not only perfect for adjusting your blood pressure, but it also helps women to prevent breast cancer. So it's very powerful and very easy to add in your muesli or add into a salad or make some sweets. You can also bake it. It's temperature stable up to 180 degrees Celsius. So you can just play around. I'm hardballing it. I just eat a tablespoon like that. Don't suffocate, please. But you can also make it more enjoyable. I'm just very efficient. I'm German. So That's me when I stare in a microscope, yet we have been digitalized in pathology, so I'm looking at a screen now, but this is what we do in the lab and in our offices. When somebody voices a concern about, for example, having a lump in a breast or having a weird mole or going to your routine coloscopy, getting a polyp biopsied, then that's getting sent to us, and we're looking at the cells under the microscope, determining if they're healthy or if they're ill, and if they're ill, what's wrong with them. And sometimes we also get these entire organs, for example, with kidney cancer, endometrial cancer, ovarian cancer. It's very interesting anatomically, and I have been caught up in the beauty of histology, which is looking at the cells and the anatomy. But then again, I've been thinking, when I think about my patient, I wouldn't want to have her or his organs. I just would want them to be healthy and not like undergo surgery. So that's what I'm doing now. And I brought you a picture because I think histology is very beautiful. Like, I love to look at pink and purple cells. And this is healthy tissue from the colon. You can see specializing cells as these small ones, which is goblet cells producing mucin. So your gut is slimy and everything is flowing. And they have crypts to resorb the minerals and vitamins, and also to distract water out of your poo. Yeah, well, so they look very pretty and they're organized. They don't harm anyone. You have to trust me on that one, because I don't know if there's any other pathologist around here. No, good for me. So, but this is how healthy tissue looks like. And can you see the difference? Yeah, so it's very chaotic. Like, the cells we're actually saying the cells are turning more blue, which means like there's more going on in the cells, like a dysregulated cell mechanisms. The cells are going crazy. They're almost on speed, like nobody's controlling them, and they're just growing, and getting invasive, as in cancer. So this is a picture. When we see that, we're like, uh-oh, we have to look deeper, and maybe when it's a biopsy, tell our clinical colleagues that this organ or part of the organ needs to be removed. And I'm still sitting there and thinking, could this have been avoided? And the answer is yes. So this is what we've just been talking about. Like, when I think about giving a cancer diagnosis is so harsh on a patient's life. It's life-changing. It is very invasive, just like you need to go to surgery. You need to maybe get some adjuvant therapy, like radiation or chemotherapy. It's very harsh on the body. But yeah, my point is, let's go in before that happens. So, how plants can fight cancer. So especially with colon cancer, a fiber-rich diet is the key. I don't know if you say it in Greek, but it's the alpha and the omega. It's perfect. Yeah, it's everything you need, because it feeds the beneficial gut bacteria, creating something that's called short-chain fatty acids, which are protective compounds. It speeds the transit time, which means less carcinogen exposure, because by digesting and the food being in the digestive tract, there are produced these carcinogens. So the faster it goes through our body and the less time it has to have contact with our body, the better. That's why there's been a misleading study on smoking preventing colon cancer, because when you smoke, you just poo a bit more often. But the risk of getting lung cancer through smoking is still not a good payoff, so don't smoke. But it does speed the transit time. That's the thing we want. And the more fiber, the more transit time, the faster transit time. And I mean, 40% lower risk of colon cancer by going on a high fiber diet? That's good. That's really good. That's, yeah. And only by eating nice food. I mean, what can we ask for? So another thing with eating plants, phytochemicals. So I'm a big fan of cruciferous veggies. Anyone else here? Yay! Broccoli, kale, Brussels sprouts, like all the small things that almost look like a polyp if you ask a pathologist, but they taste nicer. So the thing that's happening with sulforaphanes, they neutralize carcinogens, and this is a compound in the cruciferous veggies. Small hack: if you prepare your cruciferous veggies, for example broccoli, cut it 20 to 30 minutes before you eat it, because then the sulforaphane amount will get boosted and you get even more of these anti-carcinogenous components. And we love that as well. So I just put some examples because you can almost eat any plant and it's nicer for your body compared to an animal. Lycopene in tomatoes actually activated when you warm it, so it's really nice to have a good tomato soup in that one. And one of my favorites is blueberries, because the color of the blueberries, when you want to do it like in a scientific way, you can call it anthocyanin, which just means the blue color of the blueberry. And this is so powerful, it can stop cancer cell division, so like the cancer cell turnover gets slowed down. And I think it's crazy because blueberries are just fantastic and they taste very nice. So try to add 1 cup of berries to your daily diet and you're good to go. So lower IGF-1 is also something that happens when you go on plants. It's the cancer cells, they use this and produce it themselves to grow, because cancer is defined by unregulated cell growth. So it's just like autonomous cell growth. Normally cells are they follow the rules. They stop growing when they should. They die when they get old and don't mess up in our body. But when you have cancer, they go rogue. They just do anything they shouldn't. And the plant diets can reduce IGF-1 by 20 to 30%. And on top of that, also in the same cycle, it is just anti-inflammatory to eat a lot of plant food and especially whole-based plant food and not so much processed. Yep. So we talked about heart disease and how we can prevent it by going on a plant-based whole food diet. And the next big topic in the Western world, at least, is people suffering from diabetes, especially type 2, which is 90% of the diabetes that is going around. And this is directly linked to nutrition and how you live your life. 463 millions. I can't even imagine. I think I heard once that it's 1,000 people. You can imagine in your head and then it just stops. You can't even realize how many people suffer from diabetes. And how is it caused? Excessive glucose intake over time. How does it get into our bodies? I mean, it's the things we eat. It's candy, it's soda, it's processed food. Most of the processed food has added sugar. We don't even realize that it's in there. So we just eat too much of it. And it's very hard because a lot of the things that taste nice contain a lot of salt and a lot of sugar and sell very well. So it is hard to be on a healthy way, but I know you can do it. And I know with the knowledge you're getting here, you want to do it, because nothing is more precious than a healthy life. I think nobody would disagree on that point. But when we eat too much glucose, then our body's normal functions, they are kind of overwhelmed. So our cells stop responding to insulin, which would process the glucose in the blood for us. And the blood sugar stays dangerously high. So what can happen? Most of the time, it goes to your kidneys, creating damage in your kidneys, lowering the filtration rate, lowering the function. And that is really bad because people end in dialysis and need to go to blood filtration, which is in itself a really high risk of dying because it's very, very harsh on your body. You can get nerve damage. A lot of people with diabetes struggle with this ants feeling or like stingy feelings in feet and leg, it's because of the nerve damage due to the high sugar levels. A lot of people also face blindness or impaired vision, and also heart disease is linked to it. Amputations, they also come with it because of the damaged vessels and insufficient oxygen in your extremities. And then the tissue or like your toes, they just rot. And when you have something rotting in your body, the next thing that comes is sepsis, and then you die. So we remove it. That sounds very horrible in my ears, and I would do everything for my patients to not get there. So let's talk about what we can do. Oh, plants to reverse diabetes. Okay, that's very nice. I think it's so cool that we have something that is so natural and accessible that helps and supports and nourishes our body. And actually, it's not that big of a deal. You have to start and get used to it, but then you will be so happy for it when you transition to a more and more plant-based whole food diet. You will thank your later self. So this study, I think it's crazy. Plant-based diet versus standard diabetic diet. Like diabetic, not even like standard Western diet. This is already adjusted to people suffering from diabetes. 74 weeks, and the plant-based diet has been shown to be 3 times more effective at controlling blood sugar. Insulin sensitivity improved in just 3 weeks. Jesus, like 3 weeks, everyone can be that patient and then see the results and be like, oh my God, why didn't I know earlier? So 43% reduced or eliminated medications. I hope Big Pharma doesn't see this talk here, but you can do something. And yeah, weight loss without calorie counting, fun study. Moving for half an hour a day, or going on a plant-based diet, or combining the two, and guess which group had the best results? A bit of movement with going on a plant-based diet is the most efficient thing you can do for your body to stay healthy in the long run. And yeah, why it works. Low in fat, especially saturated. These are the fats we're trying to avoid. High in fiber, the cells get more responsive to the insulin again because there is not so much processed sugar in a whole food plant-based diet, and your insulin circle starts to work properly again. So we have so many bacteria in our gut. I think that's very interesting. We don't necessarily see them under the microscope because they're very small. Sometimes we see some kinds of bacteria in the microscope, but I just wanted to let you know that we really want to feed these small, cute bacteria because they're helping us. And how can we do that? We need to give them fiber. And surprise, animal products, they don't have any fiber, like 0 fiber. When you eat a steak, it is 0 fiber. And when you eat plants, there's a lot of fiber. So this is what we need. The bacteria, they help us to produce vitamins. They train our immune system. They create these beneficial compounds, the short-chain fatty acids. There's like, when you look at the microbiome, there's always a war going on between bad bacteria and the good bacteria, and they're like constantly fighting. And when you feed the bad bacteria with, for example, eating meat or dairy, fat yogurts, cheese, soda, and fast food, they will win this war. And you don't want that. You can actually change your gut microbiome to this war-winning bad bacteria in just 24 hours by eating the foods I just mentioned. And you really have to keep it going with the plant food to make this balance on the good bacteria side. So it helps us to digest food, and also we've been learning so much more about how our intestines and our brain work together. So having a good balance there is also crucial for having a good mental health. Yeah, there's many more things I could talk about, but let's continue. So we talked already about the short-chain fatty acids. They are produced by the fiber reaching your colon, then the bacteria do their magic, and what comes out is short-chain fatty acids. They reduce inflammation throughout our entire body, strengthen the gut barrier, and feed the colon cells because they also need to live from something, and regulate our immune system. And there has been so many studies, and the conclusion to all of them was the more the merrier. Eat all of the colors you can find, and the more different vegetables you eat, the healthier you are overall. So people eating 30 plus plant foods per week have the most diverse microbiomes, and that's what we're looking for. So I love him, Michael Greger. I don't know who knows him, but he's a legend. Like, he's been inspiring me so much because he really works for educating people and seeing which studies are maybe bribed by some kind of industry, which ones are real, like checking your sources and making a real impact for people taking claim of their health and life. So he has many great books, and I would recommend to read them. Just do it bit by bit because it's so much information in them. You can go on reading this for years. So Dr. Michael Greger, yeah, he also has a website that is called nutritionfacts.org. If you ever want to look something up, for example, when someone in your surroundings has been diagnosed with an illness, I would bet a lot of money that there's some sources on this website to get some info on which foods to eat, which foods to avoid, and how to deal with this the best possible way. So he developed this incredibly helpful daily dozen, and it's so nice because I know that nutrition and all the information you hear everywhere, and do this and do that and buy this supplement and just add this, it is difficult. And it's very easy. I'm sorry that this is a bit skewed, but I hope you still can read it. So there's these 12 things. You have a checklist. There's also an app, by the way, where you can just tick it off. 3 portions of beans, because we love legumes. They have plant protein, they have fiber, they have minerals. And you can eat them in so many ways. Just yesterday, I hosted a workshop where I made a strawberry milkshake with silken tofu and chickpea dough with that tastes like cookie dough, but without the sugar and with all the goodness from the chickpeas. So there are sneaky ways to live your life in a nice way and eat nice food and still eat very healthy. So check that out. And berries, we love berries. This is additional to 3 other servings of fruit. Go wild. If you're starting on this plant-based journey, don't beat yourself up if you eat a banana or grapes. There's nothing bad with any of the fruits, just eat them. Cruciferous veggies, they're key. Try to eat 1 serving of cruciferous veggies per day. It's because of this sulforaphane component that is actively working for your body and working in your body against the cancer cells. They're like cancer killers. So we like these kind of killers. Greens, go wild, eat anything. Other vegetables, the same. Just remember, try to pick different things. I think most of the people in Denmark, at least I've read a study, they're always picking the squash, bell pepper, carrots, and potatoes. Maybe mix it up a bit so you can get your diverse microbiome going. Flaxseed, we've been talking about that. You can eat it in a more smooth way than just downing a tablespoon of, or a tablespoon of ground flax seeds. Don't do it like me, it's not nice. But I'm just like very looking for this 1 component that is in the flaxseed, which is called lignans. It's a cancer-fighting hero. And yeah, thank me later, just eat your linseeds. Nuts and seeds, walnuts are great for overall health. When you just eat nuts twice a week, you halven your mortality risk at 50. So 50% more chance of living with eating just very nice nuts twice a week. I think that's a very good deal. So try to remember that one. And then I write herbs and spices, which is a bit written under this with servings, because actually nobody's aware that herbs and spices are the food group with the most antioxidants and the most power. Like when you have a tomato sauce for your pasta, whole grain, adding a teaspoon of ground oregano, you double the antioxidant amount. Like little teaspoon, and then it's just poof. So try to use herbs and spices as much as possible. Also try to use cumin, black cumin, turmeric, garlic, cinnamon. Go wild. Whole grains, really important and really overlooked. We don't eat enough whole grains. We really eat too much white flour products. So try to go for the quinoa, try to go for the whole wheat. I know, I've been living in Italy and we love our white pasta. Do it every once in a while and try to go on the whole grain train the rest of your days. Beverages. It came as a surprise to me that hibiscus tea is very healthy because it's very uncommon to drink, at least where I come from. But this is so easy again because it's so pink, and the more colors, the healthier it is for your bodies. And I'm not talking Skittles. So it's just the natural, please, just the natural colors. So hibiscus tea, green tea, really nice, and water. Skip on the soda if you can. And exercise, 90 minutes moderate, just walking, or 40 minutes of, I don't know, high rocks or something intense. Once I was invited to a high rocks class and I thought it was reformer Pilates. To all of these, you know, one is chill and one is very just like you're dead afterwards. But 40 minutes of vigorous exercise is good anyway. So I have this another tool that could help you go more plant-based if you're not already are. This checklist with the daily dozen is really nice. On top of that, I didn't write it, but there's the B12 you need to supplement. And yeah, I'm putting a 13th one, sleep enough. So then you'll live forever. And how to build the perfect plate. You can take a photo because there's a lot to read and a lot of inspiration how you can build this. But if you want to build your perfect plate, try to aim for half the plate of veggies and fruit, and a quarter legumes, a quarter whole grains, and plus you can add some nuts or pumpkin seeds, tahini. Just drizzle these flax seeds on top. You're good, and try to not use so much salt or try to cut down on your salt intake. Instead, try nutritional yeast, turmeric, garlic, ginger, fresh herbs. They have so many antioxidant power, and it's very good to go low on the salt if you want to live a long and healthy life. Yeah. People tell me as a medical doctor, you can't get enough proteins from plants. Ouch. We eat way too much protein nowadays. It does come to a surprise because the media has been do this protein powder, do this shake, add this meal, and we're eating too much. If you want to read the studies, then it says the more protein we eat, the shorter our lives get because we eat way too much. And if you want to have a number, it's 0.8 to 0.9 grams of protein per kilogram of your ideal weight. And that is actually not that much. And for example, when you eat a block of tofu, it already has 20 grams of protein in it, which is very good plant protein for your body. And then you already get 1/3 with one meal. So don't exaggerate on the protein. Plant-based diets cause iron deficiency. It depends. You really have to know what you're eating, and if you're adding tahini and lentils, eat your cruciferous and dark leafy greens, adding it with vitamin C-rich foods like bell peppers or citrus for better absorption, you're good. I think it's a lie because a lot of omnivores also are low in iron. So we can all benefit from eating healthy. And this one I love because Denmark is such a dairy country. We have the biggest milk farming industry in Denmark besides of the pig and meat industry. And actually, I moved there 2.5 years ago, and the first thing I saw was this big banner: drink 0.5 liter of milk per day to stay healthy. And I was shocked when I looked at it because I was thinking, don't they know that the countries like US, Finland, Sweden, with the highest intake of milk have the highest risk of hip fracture later? So I don't know if you live that long with a high animal milk diet, and I can tell you the studies say no. The studies you find and I found online that were preferable of consuming animal milk or cow's milk have been sponsored by the cheese industry or by the milk industry and have very interesting designs. If you want to hear more about this, just text me, because this would be very excessive. And then we can talk more about this. But no, you don't need cow's milk for calcium and strong bones. You can use fortified plant milks, leafy greens, tahini to get your calcium, and even broccoli has a lot of calcium. Yeah. As a pathologist, I've seen thousands of tissue samples and organs, and people's lives been changed with chronic illness diagnosis and cancer diagnosis. And I got very sad, and I got very frustrated, and I really wanted to change something about the way we view health, not something that needs to go wrong in the first place to act on and to try to make it work again. I think as a plant-based health advocate, I don't even think, I know we can change this narrative, and I know we can change this story. And the evidence, this is an old number. It's 15 million diet-related deaths yearly. And you can reverse so many of these illnesses or prevent both of them with going on a plant-based diet. Heart disease, cancer risk drops with fiber, diabetes disappears in some patients. It's up to you. You control your nutrition and you can choose what you eat 3 times a day. And I hope you learned something new. I hope you can take this with you. I hope you have a wonderful life, enjoy it, and do all the nice things you want.